This was our grand opening we had. We waited till the springtime to do this because we wanted warmer weather. Obviously, we opened in December, but we want the community to know that we're here to stay. We're here to support them in every way we can. We're here to provide individualized care, attention, and compassion, and that's what we're here for. Our patients, we take a lot of time with our patients. We don't rush them, and overall, I think most of our patients leave their rooms, their exam rooms, satisfied and confident in their care here. Who would be the ideal person to come here, basically?
Yeah, yeah.
Okay, anybody that has cardiac risk factors. Now, when we say cardiac, there's tons of them. The first ones that come to mind, hypertensive. So if you're a patient that's on blood pressure medication, or a patient that has cholesterol problems, or a patient that has diabetes. Diabetes is huge in the community and underrated. When I mean the undertreated is what I'm trying to say. Anybody that has diabetes is as if they have coronary artery disease. That's a risk equivalent. Peripheral artery disease, kidney disease. So any of these patients are ideal patients to come and see us. Sometimes people, or sometimes the providers in the community, think that they need to send a patient to us when they have an actual cardiac symptom, like chest pain or shortness of breath. But that's not true. It's better that they come and see us sooner than later because prevention is key, and that's our motto here. We want both primary and secondary prevention is what we're focusing on here. I'm boarded in both cardiology and medicine, and I'm practicing cardiology right now, but we are also practicing a wellness aspect to that, and that is we have professionals in the field of podiatry, psychiatry, Reiki therapy, reflexologists, and also our supplement line to help our patients. Almost everything except for electrophysiology and interventional cardiology, because obviously we don't have a cath lab here in the office or in town. The closest cath labs are in Buffalo and Rochester. So shy of interventional cardiology and electrophysiology services, we are doing stress tests, stress echoes, regular stress tests, echocardiograms, loop recorders, EKGs, and Holter monitors and event recorders. It's called the Ideal Protein Diet. In Buffalo, there's about 5 locations. We got the rights for Batavia and Warsaw, and we're going to kick that off hopefully next month in July. There's a lot of diet fads out there, so this is a little bit different from that, even though the name kind of there's protein in the name, but we could change the name of that. It says Ideal Protein Diet, but it has really not a lot to do with protein. It has a lot to do with making better choices and long-term effects. That's what really sold us to it. What I mean by that is the program is going to have 3 phases, and the first phase is basically where we provide you, the patients or the customers, with protein and the carbs and the produce and the vegetables and fruits they do at home. And by phase 2, they're slowly phasing out of that, and by phase 3, they're totally just eating from home. And the idea behind this is that they're going to have better self-control. While they're in the program, they will have a dedicated coach. So they'll have a weight loss coach and come in once a week to get weighed, not only weighed but also sized, so their arm, neck, thighs get all sized. And so they could see the improvements week by week. And on top of that, there's a lot of education. There's a lot of reading material that they have to do themselves, but also meeting with the coach on a regular basis helps them. And overall, what it's supposed to show us is that in the future, when they make decisions while they're eating, they're just basically going to make healthier choices, decisions, and hopefully keep off the weight that they lost.